Okay, we're at the ankle, and you have the malleolus here, talocrural joint. So what I like to do is I'm going to do a traction. So I want to stabilize on the calcaneus, on the anterior aspect of the foot over the midfoot, the metatarsal phalangeals, and I'm going to apply pressure in an inferior direction or towards me. I'm going to stretch the talocrural, or I should say take up the slack, sustained grade 2, traction. Now from here, what I can do is I can do the anterior posterior glides by simply stabilizing. Could you just move up a little, just a little there, right there. I want to stabilize my left hand over top of the medial lateral malleolus. I want to grasp, and when I do grasp, I want to feel the navicular tubercle in my thumb, and I want to have a small space where the talocrural joint comes together, stabilizing the malleolus over the navicular, and I'm going to do a posterior glide, sustained grade 2. So my right hand here is pushing down, and my left hand is stabilizing posterior. So I'm doing a little bit of a grade 1 and then into a grade 2. And the grade 1 is just making sure I don't compress the joint. So the grade 1 is moving in an inferior direction. A little grade 1 and then posterior, sustained grade 2. Now, from this position, do the same thing, but I'm going to come anterior. So my left hand is going to stabilize. My right hand is moving towards me, or lifting up towards the ceiling in a straight line. You don't want to do this or do this. You want to move up straight towards the ceiling. So little grade 1 and then an anterior or anterior direction. So that's traction, anterior and posterior glides with a talocrural joint. Okay, we're here at the patella. And so we're going to do several different directions. Place my thumbs on the lateral side of the patella and move medially, sustained grade 2. Place my index finger on the medial aspect and move lateral, sustained grade 2. Place my right hand on the inferior portion of the patella and move superiorly. Now, somebody who has patella femoral, has knee problems, they may react to these, particularly when you're moving anteriorly. Stabilizing, taking my left hand, placing over the superior part of the patella, and moving inferiorly. So you can move this in multiple directions. Okay, so we're going to do traction and distraction of the tibiofemoral joint. So I'm going to stabilize above the knee, grasp just above or around the malleolus, the medial lateral malleolus, and I'm going to do long axis traction directly away from the joint. Okay, now I'm going to do distraction. So what I can do is come up here, bend the knee at 90 degrees, grab around the posterior aspect of the knee and move in an inferior direction. Now, you can stabilize here if you choose to, but the femur is fairly stable, so you can do simply distraction in this direction, and towards my body. Okay? So now we're going to do a posterior glide. We find the greater trochanter right in through here. We're going to do a posterior glide of the head of the femur in the posterior direction, sustained grade 2, applying pressure, taking up the slack. Okay, now we're going to do a long axis traction, and I'm going to position my right hand just above the knee, or just posterior to the knees, and my other hand above the ankle, and I'm just going to lean and do long axis traction of the femoral head out of the acetabulum. The next one I want to do is a posterior glide in a flex position. So basically, the posterior glide, I'm going to push the femoral head in a posterior direction, moving down in this direction. Sustained grade 2. Comfortable there?
Yep.
Great. And finally, I'm going to do a distraction in flexion. So bring Megan's leg up beside my shoulder, on my shoulder, grasp here, and I'm going to move out in about a 45-degree angle towards my body, distracting the femoral head. Okay, so we're doing the hip. The hip is a difficult area to do. If the person has adhesive capsulitis of the hip, you'd have to use belts to stabilize the hip to do them. But today we're just showing the hand position. So I'm going to find the greater trochanter here. I have my right hand underneath their knee. I'm just going to lift up a little bit, find the greater trochanter, apply my palm, my hand on top of that, and apply an anterior pressure, creating an anterior glide of the femur in an anterior direction. Okay, so we're going to be working on the SI joint and the innominate bone. I'm going to be stabilizing the innominate bone or the iliac crest, and I'm going to move the sacrum in an anterior superior direction, stabilizing here. And this hand is going to be doing the movement, so I'm putting my hand over the sacrum, stabilizing the innominate bone at the iliac crest, and moving anteriorly, sustained grade 2. The other movement, I can put my hand, left hand over top of the sacrum, other hand on the ischial tuberosity, moving in an inferior direction, stabilizing the ischial tuberosity, which stabilizes the innominate bone, and move inferiorly, sustained grade 2. Now I can find the sacrum here, left hand over the sacrum, right hand over the ASIS, and I'm going to stabilize on the ASIS. I'm going to push with my left hand in a direction towards the table, moving the sacrum in an anterior direction. Okay, so again, we're going to be working on the innominate bone, and we're going to move the innominate bone in a counter-nutated direction or anterior. So I'm going to use the femur as a lever. I place my hand here. My other hand, my left hand, is over top of the ASIS, and I'm going to lift and apply pressure in an anterior direction to encourage the innominate bone to go into a counter-nutated direction. Okay? Okay, again, we're working on the innominate bone. I'm going to go a nutation or a posterior direction. So how do we do this? I'm going to place my hand on the ischial tuberosity, my left hand on top of the ASIS or anterior on the ASIS. I'm going to move in a sustained grade 2, moving in a posterior direction or moving nutated in a nutation. Holding? Good. We're going to do the metacarpal phalangeal of the index finger. We're going to stabilize the metacarpal, grasp the phalangeal, and I'm going to do a sustained grade 2 traction. And then I'm going to do a posterior glide moving towards me. You should be able to see the finger move a little bit, the knuckle move. And then an anterior glide moving my left hand towards Megan's side. All sustained grade 2. Good.